Hello everyone, welcome to another role play session. Now today we are going to do a beautiful role play where nurse is talking to the patient who has a lot of questions regarding Mrsa screening. Mr. Anthony is going to take the position of the patient and I'll be taking the position of the nurse. Hello and good morning.
Good morning.
My name is Bindya, the registered nurse in this clinic. Could you please tell me your name?
My name is Anthony.
Well, Mr. Anthony, if I'm not wrong, you have come here for a pre-operative assessment before a knee surgery this week. Am I right?
Yes, you're absolutely right, ma'am.
So before we start the procedure, could you tell me if you have any doubts to ask me?
Yes, ma'am. I have too many questions to ask you because I'm first time going for the surgery. That's why I'm a little concerned. I would like to know whether it is very necessary to get tested for this Mrsa.
Oh yes. In fact, it's one of the common questions being asked by a lot of patients who come to this clinic. Well, let me explain you more about Mrsa. Now, Mrsa bacteria that is found on the skin and the nose of many people. It is usually harmless for healthy people. However, this bacteria is resistant to antibiotics, which means it can cause complications for people if they are going through a surgery or during the recovery period. Well, now, the real reason why we are conducting the screening procedure is to control the infection in the hospital, so none of our patients will be having this infectious diseases from the hospital.
That's
Am I
good.
clear?
Yes, that is clear for me, but I would like to know more about the procedure. What are the steps involved in this procedure?
Well, I'll explain you each and every steps involved in this procedure in detail. First of all, a swab will be taken from your nose and the groin area and it is going to be sent to the lab where it goes through thorough testing.
Okay.
And the result is going to be out in few days. If the result is negative, you're fit for the procedure. Okay. Well, I can see that there is something in your mind.
Yes, ma'am. I have something to ask you that what will happen if the test confirms that I have the bacteria?
Well, that's a very reasonable question. So in case the test shows that you're positive for Mrsa, then the doctor is going to delay your procedure. And during that time, he is going to prescribe you antiseptic body wash with which you have to wash yourself. You will be asked to take extra hygienic measures like washing your hands periodically, washing your clothes separately. This will be also recommended to your family and to your carer. This is because we want to prevent the spread of Mrsa. Okay. Along with this, the doctor is going to ask you to use a nose ointment to control the bacteria. And after a few days, you'll be again tested. And if everything is fine, you're going to go through the procedure.
Okay.
Okay. Now, I still see that you are concerned and there's something else to ask me.
Yes, ma'am, you are correct. I'm a man of lot of concerns. I told to you I'm little afraid about the procedure. And could you imagine that a situation that I'm negative now and I got this bacteria from your facility while testing for this Mrsa. And because of that, I can't have my surgery. There is a chance?
Well, I can see you're really concerned, but try not to worry. Let me reassure you, such chances are very minimal. This is because of the precautionary measures we are taking in the hospital. And first step is the screening procedure where we ask all our patients to screen themselves before entering to the hospital.
Okay.
And then we have a very strict cleaning regime. All our staffs are required to wash their hands periodically with an antibiotic hand wash, which kills all the bacteria. Okay, and they are also asked to sterilize all the equipments used for each and every procedures in the hospital. The facility itself is monitored regularly, so such infectious diseases spread is controlled.
Okay, that's very good.
Yeah. We are doing a lot of measures to help our patients, so don't worry.
Okay.
Okay. Now, do you mind if I start the screening procedure?
Yes, ma'am, you can go for that. But I have to mention one thing. That is, when I came here, that time I was very stressed and scared. But when I spoke with you, you cleared all my doubts. And thank you for your cooperation.
Well, it is my responsibility and I'm happy that I could help you. Now, if you have any more questions, feel free to ask us anytime.
Okay, ma'am.
Now, can you give me your consent so that I can start the procedure on you?
Yes, ma'am. First, I have to read that, and when it is fully understood for me, then I will sign on that.
Sure, go ahead.
Thank you, ma'am.
Thank you. Well, Anthony, you were really wonderful during this role play. You had a lot of beautiful questions and it was really good.
You also equally good, ma'am.
Okay. So, in OET test, such questions are very frequent, where you have to deal with patients who have a lot of questions related to pre-procedure assessment and communicable disease. So it is better for you to go through each and every dialogue in this role play so that you get better results next time. Thank you.
Thank you.